Before we begin, I want you to try something right now. Pull off one sock, just one. Look at your calf, right where the elastic band was sitting all day. Do you see it? That groove, that indentation pressed into the skin. Watch how long it takes to go away. 30 seconds, a minute. Sometimes it's still there 5 minutes later. Now here's what I need you to understand. That mark is not about the sock. It's not about salt. And despite what most people over 60 have been told, in the majority of cases, it is not about your heart. What you are looking at is a drainage problem. And tonight, if you do nothing about it, the fluid currently sitting in your lower legs is going to quietly travel upward the moment you lie down, flood your bloodstream, wake your kidneys up in the middle of the night, and shatter your sleep in ways you may have accepted as just getting older. It is not normal. It is not inevitable. And by the end of this video, you will understand exactly what's happening and have a precise 5-minute bedtime routine that changes it. Stay with me. This matters more than you probably realize. Welcome back. I'm Dr. David Aid, and today we are talking about one of the most common and most misunderstood problems in adults over 60, chronic lower leg swelling. You know the experience. You come home at the end of the day, take off your shoes, and something looks different. Your ankles look thicker than they did in the morning. Your calves feel heavy and tight, almost wooden. You press your thumb into the skin above your ankle bone and watch it leave a small white crater that slowly, very slowly, fills back in. Maybe you've mentioned it to a doctor. Maybe you got an echocardiogram to check your heart. Maybe you were handed a prescription for a water pill, a diuretic, and told to cut salt. And maybe, like millions of people, you found that none of it made much difference. There's a reason for that. And it comes down to one system in your body that almost nobody explains to you, not fully, not practically. Today we're going to fix that. I'm going to walk you through what is actually happening inside those ankles. I'm going to give you a clinical way to assess your own swelling right now, at home. I'm going to show you the 3 patterns of lower leg swelling and how to tell which one applies to you. And then I'm going to give you a specific, step-by-step evening protocol, tested, practical, and surprisingly simple, that addresses the actual mechanism instead of chasing symptoms. Let's start at the beginning. Most people know their body has a circulatory system. Arteries carry oxygen-rich blood away from the heart. Veins carry used blood back. It's a closed loop with a powerful pump at the center, your heart, running without rest every second of your life. What most people do not know is that the body has a second drainage network, completely separate, equally important, and fundamentally different in one critical way. It's called the lymphatic system. Here's how it works. Throughout your tissues, all over your body, but especially in your legs, tiny blood vessels constantly leak a small amount of fluid into the surrounding tissue space. This fluid bathes your cells, picks up waste products, dead bacteria, excess protein, and excess water, and then needs to be returned to the bloodstream. That's the lymphatic system's job. It collects that fluid, called lymph, and moves it back through a network of lymph capillaries and lymph ducts, eventually returning it to the bloodstream near your collarbone. Your body processes roughly 2 liters of lymph this way every single day. Now here is the crucial difference between your circulatory system and your lymphatic system. Your circulatory system has a pump. Your lymphatic system does not. None. Zero. There is no dedicated pump. No organ dedicated exclusively to moving lymph. Lymph moves, and only moves, through mechanical pressure, muscle contractions, body movement, the squeezing action of your calf and thigh muscles. Every step you take, every ankle you flex, every time your calf muscle tightens, it physically squeezes the lymph vessels and pushes fluid upward, toward the heart. When you stop moving, lymph stops moving. Think of it like a conveyor belt that only runs when you're walking. The moment you sit down for 3 hours, the belt stops. Fluid leaks from your capillaries into the tissue at the same steady rate. But the removal system is no longer working. The reservoir grows, drop by drop, milliliter by milliliter, quietly, all afternoon. When you are in your 30s, this is manageable. The lymph vessels are elastic. The valves that prevent backflow are crisp and tight. A short walk restarts the whole system within minutes. But as we age, and this becomes especially pronounced after 60, three things happen simultaneously. The walls of lymph vessels stiffen and lose elasticity. The internal valves that keep fluid from sliding backward begin to leak, and the connective tissue in the lower legs loses its own firmness, becoming looser and more easily saturated. What that means in practical terms: fluid leaks out of capillaries faster, and the system that clears it runs slower and less efficiently. The math stops working, and the reservoir grows a little larger every day. This is not a heart failure story for most people. This is an aging lymphatic system that isn't getting the mechanical help it was designed to require. Before we go any further, I need to pause and draw a clear line. There are situations where lower leg swelling is not a lymphatic drainage issue. It is a medical emergency. I want you to know these, because acting quickly on them is not optional. First, if one leg swells dramatically, significantly more than the other, over the course of a few hours, and the swelling is painful, warm to the touch, and the skin looks red, do not finish this video. Call your doctor or go to urgent care today. That pattern can indicate a deep vein thrombosis, a blood clot, and it requires immediate evaluation. Second, if both legs are swelling and you are having difficulty breathing, particularly when lying flat or when climbing stairs, or if you're waking in the night feeling short of breath, that combination points to cardiac involvement that has progressed beyond mild. That is not something to address with an evening routine. That needs a physician. Third, if your swelling is paired with rapid weight gain, 4 or 5 pounds in a single week, and you've noticed foamy or unusually dark urine, that pattern can indicate the kidneys are allowing protein to escape. That needs blood work, and it needs it soon. Fourth, if you have swelling only on one side, it is painless but firm and almost hard to the touch, and you have a history of cancer treatment or radiation involving lymph nodes in that region, that warrants lymphatic evaluation with a specialist. If any of those 4 scenarios apply to you, stop here and seek evaluation first. But if your swelling is gradual in onset, affects both legs roughly equally, is worse by evening and better by morning, and you have no breathing difficulty at rest, what I'm about to walk you through is designed precisely for that pattern. Keep watching. There are essentially 3 causes of chronic lower leg swelling in older adults. They can look nearly identical on the outside. They have very different mechanisms and very different solutions. Pattern 1. Venous insufficiency. The veins in your legs have valves, little one-way doors that prevent blood from sliding backward as it travels upward toward the heart. Over time, especially with age or prolonged standing, those valves weaken. Blood pools in the lower veins. Pressure inside the vessels rises. That pressure forces water out through the vein walls and into surrounding tissue. You can often recognize venous insufficiency by a few specific signs: visible rope-like varicose veins on the calf or inner thigh, a brownish rust-colored discoloration on the skin just above the ankle. That's hemosiderin, a pigment left behind when red blood cells escape the vessels, and the swelling is usually worst after long periods of standing and at least partially better after a night of lying down. Pattern 2. Lymphatic congestion. This is the pattern we're spending most of our time on today because it's the most common and the least understood. The swelling here is soft. When you press your thumb into it, it leaves an indentation, what clinicians call pitting edema. It often involves not just the ankle, but the top of the foot, right behind the toes. The skin there can become progressively thicker over time. Crucially, this swelling is better with movement and worse with immobility. A day of traveling and walking may actually reduce it. A day at a desk or on a couch can dramatically worsen it. Pattern 3. Cardiac or renal. When the heart isn't pumping efficiently, or when the kidneys aren't managing fluid volume properly, swelling appears. But it comes with company. Shortness of breath that wasn't there before. Needing to urinate multiple times at night. Unusual fatigue disproportionate to your activity. Rapid weight gain over days rather than weeks. The swelling itself may look similar. Bilateral, pitting, worse by evening, but the accompanying symptoms distinguish it clearly. Most people over 60 with chronic evening swelling and no respiratory symptoms or rapid weight changes fall into pattern 2. Lymphatic congestion. That's who the rest of this video is for. Let me walk you through what a typical day looks like from your lymphatic system's perspective. You wake up in the morning. Your ankles look relatively normal. That's because you've spent 7 or 8 hours lying flat. Gravity wasn't pulling fluid into your legs. Your lymph system had most of the night to quietly process what accumulated yesterday. By morning, you're close to baseline. You get up, have breakfast, sit at the kitchen table. Then you sit in the car. Then you sit at your desk or your chair in the living room. By 2 in the afternoon, you've been vertical for 6 or 7 hours, but mostly still. Your calf muscles have barely contracted. The lymph conveyor belt has barely moved. Meanwhile, fluid has been steadily leaking from your capillaries into the tissue of your lower legs, a teaspoon at a time, drop by drop, quietly filling the reservoir you can't see. By evening, the sock mark appears. The ankles are visibly fuller. Your rings feel tighter. Your calves feel like they're wrapped in something. Now here's the part that damages your sleep. When you lie down at night, gravity is no longer working against the fluid. All that accumulated water in your legs slowly begins to reabsorb into your bloodstream. Your heart suddenly has more volume to handle. Your kidneys detect the shift and respond by producing more urine. You wake up at 2 in the morning, then at 4, then at 5:30, and by morning you're exhausted from what you thought was just aging, from what you thought was just poor sleep. This is the cycle, and it runs every day, invisibly, unless something breaks it. The protocol I'm about to give you is specifically designed to break this cycle at the right time, in the right way, so that the fluid drains before you lie down, not after. Before we get to the protocol, I want you to assess where you're starting from. These 2 tests take less than a minute combined, and they will give you a meaningful baseline. Test 1. The pit test. Find the bony ridge that runs down the front of your lower leg, your shin. Move your fingers down about 4 inches above your ankle. Press your thumb firmly into the soft tissue beside the bone. Hold steady pressure for 15 seconds. Release your thumb and look. If the skin springs back immediately with no visible indent, that's a good sign. If you see a slight dent that fades within about 10 seconds, that's grade 1 pitting edema. Mild. If the dent is deeper and takes 30 seconds or more to disappear, grade 2. Moderate. If the dent is deep and visible for a full minute or longer, grade 3. That level of accumulation warrants mention to your doctor, especially if it's new. Write down your grade. You'll retest in 2 weeks after starting the protocol, and the change is usually very measurable. Test 2. The stemmer sign. This one is less known but clinically meaningful. Try to pinch the skin on the top of your foot, right behind your second and third toes. Use your thumb and forefinger. Try to lift it into a small fold. If you can easily lift a small fold of skin, your lymph flow is relatively intact in that area. If you cannot lift the skin at all, if it feels like the skin is almost fused to the underlying tissue, that is called a positive stemmer sign, and it is one of the clearest simple indicators of chronic lymphatic congestion. It means the tissue has been saturated long enough that the protein content in the fluid is beginning to cause structural thickening. Neither test is a diagnosis, but both give you a real sense of where you are right now. 3 things that most people over 60 do daily, without realizing how significantly each one affects lymph accumulation. Hidden sodium. not the salt shaker, the invisible sodium buried inside the foods most of us eat without thinking. Deli meats, aged cheeses, canned soups, bread, condiments, frozen convenience meals, restaurant portions. Sodium pulls water from your bloodstream into surrounding tissue. Your body retains roughly 4 cups of water for every gram of excess sodium it takes in. Most adults consume nearly double the sodium they estimate. You don't need to go sodium-free. You need to identify the 2 or 3 biggest hidden sources in your daily eating and reduce them deliberately. Evening immobility. The hours between dinner and bedtime, when you're finally relaxing, when you feel you've earned the right to sit still, are the hours when your legs accumulate the most fluid. 3 hours of immobility after your largest meal is close to the worst possible preparation for overnight lymphatic reabsorption. Small interruptions in that sitting, even 2 minutes of walking around the house every hour, make a measurable difference. Alcohol in the evening. Even a single glass of wine or beer dilates your small blood vessels, which increases the rate at which fluid leaks from capillaries into tissue. At the same time, alcohol suppresses the hormone that tells your kidneys to slow down urine production at night, which means you lose more fluid overall, your body becomes mildly dehydrated, and your lymph becomes thicker and harder to move. The net result, ankle swelling that's visibly worse by the following morning, and sleep that's more fragmented. These are not judgments. They are mechanisms. Knowing them lets you make informed choices. Now the other direction. The things that actively support lymphatic function. Water, more than you think. This is the most common counterintuitive thing I explain to people with swelling. Most people reduce their water intake when their ankles are swollen, reasoning that less fluid in means less fluid out. The opposite is true. Dehydration makes lymph thick and sluggish, harder to push through the vessels. Well-hydrated lymph is thin and flows freely. A reasonable general target, roughly half your body weight in ounces of water spread across the day, with deliberate tapering after about 5 in the afternoon to protect your overnight sleep. Flavonoid-rich foods. Flavonoids are plant compounds found in dark berries, buckwheat, red cabbage, and citrus peel. Among their documented effects is the strengthening of small blood vessel walls, which directly reduces the rate at which fluid leaks into surrounding tissue. A cup of mixed dark berries per day is one of the simplest, most evidence-supported things you can add to your diet if you're dealing with chronic lower leg swelling. Effects accumulate over 6 to 8 weeks of consistent intake, adequate protein. This one surprises many people. In your bloodstream, a protein called albumin acts as a kind of molecular sponge. It holds water inside the vessels. When albumin levels fall, which happens gradually with aging and inadequate protein intake, water leaks out of the vessels more readily and accumulates in tissue. Mild protein deficiency is surprisingly common in adults over 60. 2 meaningful servings of quality protein daily, eggs, fish, poultry, lentils, cottage cheese, directly supports the physics of fluid balance. Magnesium. Magnesium is involved in smooth muscle tone, including the muscular walls of lymph vessels. Deficiency is common in older adults and rarely tested for. Pumpkin seeds, dark leafy greens, and almonds are practical food-based sources worth adding consistently. This is the core of everything we've discussed. Each step has a specific purpose. Do not skip steps. Morning, before your feet. Touch the floor. While you are still lying in bed, do 30 ankle pumps. Point your toes away from you, then flex them back toward your face. 30 repetitions. This takes under a minute. Why does it matter? After 8 hours of horizontal stillness, the lymph system is dormant. This small movement restarts it before gravity pulls everything downward the moment you stand up. It's a simple way to begin the day ahead of the fluid, rather than chasing it all afternoon. Daytime. Hourly movement interruptions. Every hour you are sitting, do 20 calf raises or calf pumps. If you're seated, keep your heels on the floor and pump your toes upward and back. If you can stand, rise up onto the balls of your feet and lower back down, 20 repetitions. This keeps the conveyor belt running throughout the day, so the reservoir never gets a chance to become a lake. Set a phone reminder if you need to. The 30 seconds you invest each hour is worth far more than you'd expect. Before dinner, 5 minutes of walking, not exercise, not a workout. Just 5 minutes of slow, continuous walking before your evening meal. This activates the deep calf muscles in a way that seated pumps cannot fully replicate, and it gives the system a meaningful push at the point in the day when fluid levels are at their highest. Before dinner, not after, not when you're already settled in for the evening. The evening protocol, 90 minutes before bed. This is the most important piece. Find a clear wall. Lie on the floor or on your bed with your hips close to the wall. Extend your legs straight up, heels resting against the wall at roughly a 90-degree angle. Your heels should be above your hips above your heart. Stay in this position for 15 minutes. During those 15 minutes, first 5 minutes, do slow ankle circles, 10 in each direction on each foot. Then alternating ankle flexes, 20 repetitions. Next 5 minutes, place both hands flat on your abdomen and breathe. Deep, slow inhalations through the nose, your belly rising fully. Long, controlled exhalations. This matters enormously and most people skip it. Here's why it works. Your main lymphatic drainage vessel, the thoracic duct, runs along your spine directly behind your diaphragm. Every deep diaphragmatic breath physically compresses and then releases that vessel, creating a pumping action. Slow belly breathing is literally pumping your lymph. 3 to 5 minutes of this during the elevated leg position is clinically meaningful. Final 5 minutes. Continue breathing. Allow your body to rest in the inverted position. When 15 minutes are done, roll gently to your side and sit up slowly. After the elevation, manual drainage strokes. Now, while still on the floor or bed, start at your ankle. Using the flat surface of your fingers, not your fingertips, the flat of your fingers, stroke the skin upward toward your knee. Slow, deliberate, always moving toward the heart, never downward, 10 strokes on each leg. This is a simplified version of manual lymphatic drainage. You are physically guiding fluid from the tissue space into the lymph capillaries, which then carry it upward. After you complete this sequence, you will very likely feel the urge to urinate within 20 to 30 minutes. Go. That fluid, which your body has moved out of the tissue and back into the bloodstream, is now being processed by your kidneys while you are awake and in control of it. That is fluid that would otherwise have woken you at 2 or 3 in the morning. You've changed the timing, you've kept the sleep. I want to be honest with you about what this protocol does and does not do. It does not cure underlying venous insufficiency. It does not replace medication if your physician has determined medication is necessary. It does not address cardiac or renal causes of swelling. What it does, when the primary mechanism is lymphatic congestion, which is the most common pattern in otherwise healthy adults over 60, is give the lymph system the mechanical assistance it was always designed to receive but stopped getting. Within the first week, most people notice the sock mark is gone by morning instead of still present. Within 2 weeks, the nighttime urination frequency typically reduces, often from 2 or 3 times to once or not at all. Within 3 weeks, the evening swelling that used to be dramatic is noticeably, measurably reduced. Not eliminated in every case, but substantially better in the large majority. These are not extraordinary claims. They are the predictable result of giving a passive drainage system the conditions it requires to do its job. Retest yourself with the pit test and the stemmer sign at the 2-week mark. Write down what you observe. That record matters, both for your own understanding and as something worth sharing with your physician at your next visit. Let me bring everything together. Your lymphatic system is responsible for draining excess fluid from your tissues every single day. Unlike your heart, it has no dedicated pump. It relies entirely on mechanical movement, your muscles, your breathing, your daily motion. As we age, This system slows, vessels stiffen, valves leak, connective tissue loses firmness, fluid accumulates faster than it's cleared. The result is lower leg swelling that worsens through the day, reabsorbs overnight, fragments your sleep, and has almost certainly been attributed to your heart or your salt intake when the real story is your lymph. The protocol is 5 steps. Morning pumps before your feet hit the floor, hourly calf movement throughout the day, a short walk before dinner, 15 minutes with legs elevated before bed, with deep breathing, and 10 upward strokes on each calf to complete the drainage. 2 weeks. Retest. Observe the difference. That is the entire framework. Your legs are not failing you. Your ankles are not betraying you. What you have is a drainage system that stopped receiving the signals it was designed to need. And the remarkable thing is, you can provide those signals yourself, deliberately, in under 5 minutes a day. The change is not subtle. It shows up in your shoes. It shows up in your sleep. It shows up in how you feel when you wake up in the morning and don't have to press your thumb into your calf to check. If this video gave you something useful, and I hope it did, please take 1 second to like it. It tells the platform that this kind of information is worth sharing, and it helps the next person who needs it find it. If you're not subscribed yet, subscribe now. We cover longevity, aging, preventive health, and practical wellness on this channel, the kind of information that makes a real difference in how you live day to day. And I want to hear from you in the comments. Tell me your age. Tell me where in the world you're watching from. And if this is something you've been dealing with silently, tell me. Your comment might be exactly what the next person needs to feel less alone in this. If someone in your life has been living with evening swelling, struggling with interrupted sleep, being told it's just their heart, share this video with them. You may be giving them the explanation nobody ever actually gave them. I'm Dr. David Aid. Take good care of yourself. I'll see you in the next one.